This show is for educational purpose and should not be taken as medical advice. Welcome to Let's Talk About Medical Weed with Dr. O, a clinical pharmacist certified in medical cannabis. Every week, you'll learn about alternative ways to improve your health and well-being using the healing power of botanicals such as cannabinoids. Here's your host, Lola Ahanba.
Hi guys, welcome to episode 2 of Let's Talk About Medical Weed with Dr. O. I'm glad you are able to join me today. My name is Lola Ahamba. I'm a clinical pharmacist specialized in medical cannabis. This show is for you if you are looking for alternative way to maintain your health and well-being using the healing power of botanicals such as cannabis. This show is also for you if you are a healthcare provider or healthcare specialist looking for evidence-based data to counsel your clients on the cannabinoids and cannabis products. And it's also for you if you are a young adult, active young adult looking for alternative ways to replenish lost energy during the regular day-to-day activities. Before we get into the details of today's show, allow me to say that the purpose of this show is educational. Any data or information presented should not be taken as medical advice. If you need any medical advice, please consult with your physician. And please do not take any medication or supplement without consulting with your primary physician. Today's topic is what I call the entourage effect. One will chase 1,000, 400 will chase how many? So we will get into the details of that as the show goes by. In this episode, I talk about the difference between marijuana and industrial hemp. I also talk about the entourage effect and its advantage in the full spectrum cannabis plant. Finally, we're going to be looking into the terpenes and its potential benefits in our daily lives. At the end of the show, I will give you one of my cannabis fun facts that you absolutely do not want to miss. So stay tuned. I'm sure we've all heard about marijuana, hemp, weed. So what is in the name? What is so special about that name, marijuana, weed, hemp? Hemp and marijuana, weed, they all belong to the same families of the cannabis family. But the difference between hemp and marijuana is that the difference is in the level of THC that is seen in this product. For marijuana, the THC level is from 5% and above. For the medical marijuana and the recreational marijuana, it has to be in the range of 5% THC. On the other hand, for the hemp-derived cannabis, the THC level is below 0.3%. The THC level in hemp products, these are called industrial hemps. So due to the passage of the Farm Bill, hemp-derived CBD now federally legal to use and carried across state line. So the hemp-derived CBD are called industrial hemps. And the THC in this hemp product that is supposed to be less than or equal to 0.3. So these are federally legal and it can be carried across state line. On the other hand, the medical cannabis and the recreational marijuana products, because they have a higher THC level, those are still considered illegal federally and cannot really be carried out. Of course, although some states legalize recreational. So for the states that legalize recreational marijuana or cannabis, they can carry that within the state, but interstate, carrying it across different states is still federally illegal for cannabis products that have a THC level higher than 5%. I'm sure we've all heard about THC and CBD. THC, the full name is tetrahydrocannabinol, and CBD, the full name is cannabidiol. All these products are part of the cannabinoid that is found in the cannabis plant. THC and CBD are the main cannabinoid found in the cannabis plant that produce the therapeutic effect that we see. So aside from THC and CBD, there are other chemicals found in the cannabis plant that works hand in hand with the THC and CBD to give it its unique therapeutic properties. The interaction of these chemicals and all the cannabinoids working together hand in hand, the interaction of this cannabinoid product is what is called the entourage effect. It was said that cannabis plants contain over 400 different chemicals that contribute to its entourage effect properties. Entourage effect is what I describe as one will chase 1,000, like in the biblical saying, one will chase 1,000, two will chase 10,000. So in the cannabis plants, we have over 400 cannabinoid and chemicals working hand in hand for the synergistic effect of the unique properties that we see in the cannabis product. So I normally look at it like this, that, okay, if one is chasing 1,000 and two is chasing 10,000, imagine how much 400 of these compounds in the cannabinoid plant will chase. It is just so awesome, the level of the chemicals, cannabinoids, aromatic, carbon, phenol that is found in the cannabis product that is working together for us to be able to see the uniqueness of this botanical plant. According to Dr. Raphael Mechoulam and his colleague Dr. Ben Shabat, these are the people that proposed the entourage effect. They investigate the effect of the active compound found in the cannabis, and they said this cannabis effect cannot be duplicated in the single molecule cannabinoid like dronabinol or marinol. This entourage effect gives it its unique properties that is unable to be duplicated by other single molecule pharmaceutics. Studies have shown that a single molecule agents are not as effective as a whole plant extract due to the lack of entourage effect seen in a whole plant extract. Basically, what we're saying is that in a single molecule product, like say dronabinol, because it doesn't have other compounds or chemicals or cannabinoids working hand in hand, it's not seen as effective as in cannabis plants that has all these other products, other cannabinoid, other chemicals, phenols, contributing their own uniqueness to the overall effectiveness of the botanical plant. So I guess it will be safe to say that the effect of the cannabis or the cannabinoid product or compound actually depends on the chemical composition of the plant, because cannabis plants are from different areas of the world. They are under different weather, different soil conditions. They all have their own uniqueness. One botanical plant, indica, is totally different from cannabis sativa. Even just planting the same crop in one area, you will have a different effect when you plant it in another area. So it's very, very unique in its properties based on where it's planted or where it's produced. Of the over 400 different compounds, chemicals found in the cannabinoid, in the cannabis plant, about 66 of them are actually cannabinoid. The other chemicals that are found in the cannabis plant are terpenes, flavonoid, phenol. We have the essential oil, we have the lipids and the wax, where the lipids are where we see this unsaturated fat. Cannabis is said to have one of the lowest saturated of fats. So we have the lipids and fats. We have fibers that are used for clothes. We have amino acid. Amino acid are the chemical components of proteins. Our body is made up of proteins, and these proteins are made up of amino acids. We also have ketones, which are always source of energy. So all these are the compounds that are working together in the cannabis plant to give it that uniqueness that we see in this botanical. Studies suggest that the synergistic effect of these chemicals and compound in the cannabis helps to counteract the negative effect of some of the components, especially the THC. So basically, there has been studies that show that some of these compounds, they're not just there for being their sake. They helps to counteract some of the negative effect that is seen, especially with THC. Of the chemicals that are seen in the cannabis plant, terpenes such as linaloic found in the lavender is said to reduce the anxiety induced by high THC level. Terpene is one of the major chemicals that are found in the cannabis plant, and they comes in different forms, shapes, smells. Terpenes has are responsible for the smell, the strong smell that we experience in the cannabis plant. Terpene is said to be the most common chemical found in nature. It's found in almost all the botanical plants. Plants make terpene as part of their defense mechanism. Single molecule cannabinoids such as dronabinol, marinol are said to have a more side effect when you compare it to the whole plant extract of the cannabis, because there is no entourage effect to counteract the negative effect of the single molecule. For example, marinol is said to be less tolerated in patients due to increase in sedation and dysphoria compared to the whole plant extract. And some of what makes the whole plant so unique is the presence of all those chemicals, especially terpenes, that is seen. Interaction between terpenes and cannabinoid is said to help alleviate and manage a host of conditions such as inflammation, pain, depression, seizure disorder, cancer, just to mention a few. Some of the terpenes and what they are used for, we're going to be going into that now. The first one we would like to talk about is the marcin. Marcin is seen in mango, in herb, and it's also prevalent in the cannabis plant. So it's not just seen in the cannabis plant, it's also seen in botanicals like mango. And what does it do? What is the properties of this terpene? It works as a sedative agent. According to studies, that this marcin has the potential for sedation, also has a muscle relaxant properties, and has a analgesic effect. The analgesic effect is what is used in pain management when it comes to this terpene, and it also has anti-inflammatory properties. The anti-inflammatory properties are what we see in pharmaceutical products like NSAID, which are like, we have aspirin, ibuprofen, naproxen, we have medroxy packs, hydrocortisone. In fact, all our steroids, the way they work is using the anti-inflammatory properties. So the marcin is one of those terpenes that have the potential to help alleviate these conditions. The second terpene that I would like to talk about is limonene. Limonene has a strong orange-like smell to it. It has a sharp smell that has that fruity smells of orange, and it also prevalent in the cannabis plant. It's said to have antidepressant properties and can cause breast cancer cell to commit suicide. That's self-death. It has been used clinically to dissolve gallstone, and also helps in mood alleviation and heartburn and GI gastrointestinal disorders such as GERD. So the next terpene we will be looking at is the linalool, that is found in lavender and flora. This terpene has anti-anxiety properties. It helps in reducing stress. It's a very powerful anticonvulsant and also serves as an antidepressant. helps in the calmness, and helps with sleep. These are the potential properties that is seen in the linalool that is found in other plants and flora, lavender. That's where you can find that. Then we can talk about the pinene. Pinene is a strong pine, just like the name. It has that strong pine smell. Is the most common of the terpenoid. So the pinene is the most common of the terpenoid. It works as an anti-inflammatory and a bronchodilator. When you talk about bronchodilator, we're talking about, say, for example, our asthma product. Those are works under the bronchodilation mechanism of action. So this product, the pinene, is being looked at to maybe potential have effects in helping with asthma. And there were some studies that are looking into it. Maybe in the future, they're going to be making some product with these terpenes in there to probably help with asthma, COPD, all those breathing conditions. It also helps with promoting memory retention. And the way it does that is that it helps with memory retention by inhibiting the breakdown of acetylcholinesterase neurotransmitter. Basically, what it does is breaks down this neurotransmitter in the brain called acetylcholinesterase. So by doing this, it helps to stimulate the brain for recognition and memory stimulant. The next terpene we look at is the ocimene. The ocimene has the fruity floral smell to it, and it also has anti-inflammatory properties. It's used in a lot of perfume. It also has antifungal effect and anti-candida effect. Basically, one can see it being used in the candida species, the fungus kind of infection. That's where the pinene will probably be used if it's being used in a pharmaceutical product. The next one we're going to be talking about is the beta-carotene. This is the kind of terpene that you find in black pepper, oregano, and clove, and it helps with the gastrointestinal protection, has the gastrointestinal protection property. So this terpene can help with, it can also probably help with inflammation, autoimmune disorder. It can be used as a dietary supplement with strong anti-inflammatory analgesic effect and has low attributable psychoactivity. Basically, this one does not have psychoactive properties. So the next one we'll look at is the terpinolene. The terpinolene is also smells like pine. It has the kind of sweet herbal smell, like a lime smell to it. This one also has an anti-inflammatory property. It has antibacterial properties. It has antioxidant properties in it. And it also helps with anti-cancer effect in rat and brain cell. So the next one will be the alpha-humulene. The alpha-humulene has a kind of hoppy, earthy aroma, and it helps with appetite suppressant. So this one the property can be used maybe to develop products that is going to help with obesity and metabolic syndrome kind of condition. And then finally, we'll talk about the neurolidol. The neurolidol is the floral citrus kind of a terpene. It helps more with sedation. It looks like most of those ones that have like a floral kind of smell to them, those kind of help with calmness and helps with sleep, sedation. This one also has antifungal, anti-malaria activities, and it's also said to have anti-protozoa. Malaria is a protozoa in nature. It has a low level in orange. Low level of this nerolidol is found in orange as well, not just in cannabis. So it's also found in orange. So interaction between terpenes and cannabinoid is said to help alleviate and manage a host of conditions like we've just mentioned: inflammation, pain, depression, seizure disorder, and also being looked at to probably help with cancer as well as antibacterial, antifungal properties. So as a result of all these compound, chemical, cannabinoids, aromatic compound, phenol working hand in hand, a lot of products are being looked at. Cannabinoid products are being tailored to kind of target all these specific properties of these chemical compounds found in the cannabis plant. So it looks like the future of the cannabinoid therapeutic is going to be a target synthesis of these cannabinoid products and cannabinoid terpenes chemicals to have a kind of specific target for whatever condition they need to use it for. Yeah, so even though a lot of the studies that is going on there, they kind of trying to target some of these specific chemicals and compound and cannabinoid to try to develop pharmaceutics along that line, it's still not compared to the whole plant extract. It's just like, for example, yes, we can get our vitamin B from orange, from spinach, and all these other product over the counter, but when you get your vitamins from the over the counter, it's not the same as when you take your kale, you take your spinach, you take your orange. It's totally different. The whole plant extract has the entourage effect, enhancing its properties, whereby single molecules like dronabinol or even our vitamins that we buy over the counter does not have that entourage effect. So the uniqueness of a whole plant extract, it cannot be underestimated. So it seems that the whole plant extract is probably the future of cannabinoid therapy. In the future, it looks like people are going to want to choose broad spectrum cannabinoids to have the total entourage effect of the product. So that's what we got today. But before we go, let me give you our fun fact for today. So did you know that the edible cannabinoid, the one that is ingested, they absorb slower than when you use a cannabinoid product as a transdermal or sublingual, or even in the inhalation, like when people smoke it. When you take in cannabinoid as edibles, it goes through what we call first pass metabolism through the liver. Some of this product is lost in the first pass in the liver. But when the end product of the digestion is more stable than when people take cannabinoid as maybe inhaled cannabinoid or transdermal or sublingual. So when you out there trying to get a product, it's very, very essential to start slow, go slow. When people are taking cannabinoid as edible, we need to tell them that you have to start slow, go slow. Because sometimes you take edibles and you feel like, oh, it doesn't have effect. That can increase the level of the cannabinoid in the product, in the body. So we have to try to counsel our clients. We have to understand that there's a difference in route of administration makes different. So we will be talking in detail in upcoming episode on the route of administrations of these cannabinoids, their mechanism of action, how it works, and also it depends on what one is trying to use the cannabinoid product for. For example, pain is one of the major conditions that is being used for. So if somebody is experiencing, maybe say pain right now, they might want to say, okay, maybe it's better for me to use tincture that is going to go under my tongue and go straight to the body without going through the fourth plasma metabolism. But if it's something that is like continuous, one might want to look into the edible phase of the spectrum. I want to say thank you to you guys for hanging out with me today. It really means a lot to me. Please, I would like you guys to subscribe to the show. If you have not done that yet, please do subscribe. If you have already done, I would like to say thank you so much. We need you guys to please subscribe so we can keep the show going and keep improving on this show. So for more information about what we're doing, you can visit us on the web at wci-health.com. And until next time, always remember, health equals wealth.
Please subscribe on Apple Podcasts or any podcast platform. For more information, visit our website at www.wci-health.com. Until next time, health equals wealth.